Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuvir Deshpande from Pune, Maharashtra State, would like to welcome you all in my Ayurveda Academy YouTube channel. As everybody knows that I am MD in Ayurvedic Medicine and MD in Ayurvedic Physiology. For paid online consultation, you can definitely WhatsApp me on 922681060. Always, always, always. The number is given in the description also. Don't worry. Okay. So this particular series is regarding the patient's complaints in the general medical practice and how when the patient comes with the different complaints, how your family physician, family doctor, general practitioner think about your problem and how he has a different cause finding technique that he adopted by just asking the different questions. Sometimes he needs the investigations, and of course he manages in what I can say the standard manner. So today we have the case of, say example, 8-year child, and father has brought to that child to the clinic, and the complaint was the child is not eating very well and he is having the abdominal pain intermittently, especially at night, and after the food, after the meal, the child is getting the pain. Okay. So this is the main complaint of that child, and doctor has to find out the cause for it. Okay. Now, the doctor can first step can ask, hey, my boy, tell me where exactly you are getting the pain. So child will point to the umbilicus. That pointing into the umbilicus, that means around the umbilicus he is getting the pain. So most probably he can have the worms inside. Worm problem, parasite problem, helminthic problem can be there behind that particular problem of what you can say the pain in the abdomen. So the deworming is the basic requisite for any pain in abdomen in any child. Very simple technique. Okay. Then naturally the doctor is asking to the father whether your child had previously eating a lot of mud. Yes, doctor, I don't know, but he still sometimes intermittently eat the chalks and all these things. Okay, okay. So this can be the calcium and iron deficiency. Try to understand. Then doctor will take the child to the window and look for the sclera, white part of your eye, sclera for the icterus. Icterus means yellow color. Because not eating or having anorexia can be because of the jaundice. Infective hepatitis is the main cause for getting this type of anorexia. Then doctor can check the pallor. Say tongue examination of the child is very important. Also the nail examination is very important. Paleness of the conjunctiva, paleness of the tongue, paleness of the nails, all going toward the anemia, hemoglobin level, red blood cell level. The doctor should examine the blood for hemogram ESR. By hemogram ESR, the doctor can get the hemoglobin percentage, which should be normally 12 to 14 gram%. If it is below 10, mild anemia, below 7 gram%, moderate anemia, less than 5 gram%, which will require the blood transfusion, severe anemia. Anyway, for this particular child, anemia can also the cause of the anorexia. Anemia can be the effect of anorexia and must be treated immediately. So this sentence is very important. Anemia can be the cause of anorexia and anemia can be the effect of anorexia because the child is not eating properly. Okay. Then the doctor will ask the child lie down and palpate the abdomen gently all over the. So mild tenderness around the umbilicus may be the problem in the small intestine. Usually this problem is of worm infection. If there is a tenderness over the large intestine, colon, then the case is maybe of amoebiasis, entamoeba histolytica, EH, or Giardia lamblia. So these are the two important organisms which can cause amoebiasis or giardiasis. Here, the child can have the stools very sticky, very sticky, and he is not getting the large amount of stool, but he is going and there is a lot of cramp in the abdomen, spasmodic pain. This is a typical of this amoebiasis. Very little sticky stool with lot of spasmodic pain in the abdomen. Next, the doctor will go further and chest auscultation and lungs and heart sounds, etc. Doctor should never forget to palpate the liver, because in routine case, liver should not be very big, liver should not be tender, but soft tender liver indicates the, again, jaundice. Okay. Then the doctor can ask to the father whether the child is getting wheezing at night, because wheezing at night is also a common symptom associated with worm infestation. Doctor will auscultate for the RAS, that is wet sound because of the fluid inside the lung, rhonchi because of the bronchospasm. Doctor will also try to find out the murmur, if any. Murmur is a abnormal heart sound. Normal heart sound, lup dub, lup dub. But if lup dub, lup dub, this sound, can you hear? Can you hear? This is something abnormal heart sound, that is a murmur. Anemic patient, anemic child may have the hemic murmur. Try to understand. There is no heart problem, but anemia is there. So anemia also can give hemic murmur, that is ejection systolic murmur in the pulmonary area. Ejection systolic murmur in the pulmonary area is common with the anemic child or the adult person. Then the doctor can ask to the father or even the child whether there is any itching at the anus or around the anus. Then if it is itching around the anus, then doctor should examine the anal area, and you can see very small tiny worms over there directly with the doctor's eye. Doctor can check it out. Okay. So the simple thing, the child may have the roundworm, threadworm, hookworm, or the tapeworm infection. Generally, if around the anus itching is there, threadworm possibility is there. If the patient is anemic, anemia is common with the hookworm. Then white patches and excessive eating and no weight gaining is common with the roundworm. If the patient is taking non-vegetarian or the meat or the pig's meat, then it is also common that he can get the tapeworm infection. Okay. So the most important thing for worm deworming in Ayurveda, Vidangarishta is the best treatment. Vidangarishta for worm is the best treatment in Ayurveda. Vidangarishta, the bottle is shown over here, Vidangarishta. Then of course, treat the anemic condition. Their Raricap HT, for example, in the allopathy, Raricap HT, RARICAP, Raricap HT tablets are available, liquid is available. That can be given for the iron and calcium deficiency. Then actually the deworming process better should be done for each member of the family, including servants. Then also ask the patients and other relatives to cut their nails, and always make a habit to wash the hand before starting the food. If anemia is severe, then definitely hemogram, hemoglobin, WBC count, peripheral smear, stool examination for occult blood, kidney ureter bladder x-ray, all these investigations are important in the cases of not responding usual management for the worm. My dear friend, this was the video related with the child having the pain, and the cause may be worm infection. So thank you very much for your patience hearing, and I request like this video, share this video, and don't forget to subscribe my YouTube channel to boost my energy. I wish you all the best. Take care and see you soon.